stimulates them to cough and have more secretions, and so you want to make sure that you do that so that when you do the trach care, then you've got them all cleaned up. If you come into the patient's room and he has a trach and he's laying flat, get his head of his bed up. You want the head of his bed up at least 45 degrees, so he shouldn't be laying flat.
This is for
secretions and airway management, help with his breathing. Okay, so when I'm getting ready to do sectioning and trach care, I want to make sure that I've got all my equipment in the room before I come in. And so I'm going to have a suction catheter kit, I'm going to have my goggles, I'm going to have some normal saline or sterile water, something that I'm just going to rinse my catheter out with. Have my stethoscope, have a check, and then I want to check my equipment to make sure it's working. When you're sectioning someone, you want your sectioning to be set to between 100 and 120. Any greater than that, if it sucks up to the mucosal wall, you can cause trauma. So that's why you don't want it to be any greater than 120. So between 100 and 120. Our section units don't work like they're supposed to. We used to be able to set them. So I'm just going to turn it on and check to see, and you can do this when you have your stuff on. But you want to check, and I want to adjust it. This isn't an adjusting, but I'm telling whoever's field testing me, I'm adjusting this down to be between 100 and 120. Because if I put my finger on that, that means that's sucked up to my mucosal wall, and I want to know how much pressure is it pulling if it was completely closed off. So my sectioning is on. This patient right now is on room air. She's not on supplemental oxygen. But I know that when I get ready to section her, what am I sucking out?
Air.
Her air, her oxygen. And so I want to make sure that before I section her, I have her take some good deep breaths for me. So I'm going to instruct her before I get started. I want you to take 3 deep breaths for me. Now, see, she's breathing. She's deep breathing for me. So she's on room air because she can maintain her oxygen saturation on her own. If she was on oxygen and was getting supplemental oxygen, this is the nasal cannula, but say she's getting supplemental oxygen, and right now she's at 4 liters. I know that she's having trouble maintaining her oxygen saturations, or she wouldn't be on oxygen. So if I'm getting ready to section out hers, what do I need to do? What do you think you need to do? Bump it up. I'm going to turn it all the way up to 15 liters. That's 100% of oxygen, thereabouts. That means that when she's taking 3 deep breaths right now, she's really loading herself up with oxygen, because I'm getting ready to remove that and suction out secretion, air, oxygen. So I want to make sure that she gets as much as she can each time she takes a deep breath. But right now my patient's just on room air, so we're going to set this off to the side. So I've got my suction on. I've got it set. It was probably being about 112. So that's good, because I know that it's in between where I need to be. I had already come in when I did my assessment and had introduced myself, identified my patient, and during my assessment, when I was listening to her breath sounds, is when I could hear some rhonchi. I could hear some secretions in there. Rhonchi, it's in those large airways, something I can section out. She's coughing, but she maybe has a weak cough. She's not able to cough them up all the way, so I'm going to help with that. So I've listened. I know that I need to section her out. Because she has this, she may not be able, isn't going to be able to talk while I'm doing stuff. She's not going to be covering things up to talk. So I'm going to say, Miss Jones, I'm getting ready to section you out. Have you been sectioned before? I know it's a little frightening because it feels like I'm taking all your air away, but that's okay because I'm going to give you time in between to take some deep breaths for me. I've got an O2 sat monitor here, so I'm monitoring her oxygen and her pulse. Because I know that when I'm sectioning her, I'm stressing her out. And if I see her heart rate jump up like from 80 to 120, 130, whoo, I've just really stressed her. Guess what? I'm going to take my thumb off the sectioning. I'm going to get out and I'm going to take some good deep breaths for me. If I see her breaking down, guess what I'm going to do? I'm going to take my thumb off the section. I'm going to get out of there and I'm going to have her take some nice, slow, deep breaths for me. And I'm going to look and I want to make sure that her heart rate comes back down to that baseline and what her oxygen saturation is. Because I know that it's stressing her out, that means that I'm either going to have to be in there I'm going to be a little quicker about what I'm doing, or, I'm going to have to change something. And I may not, because 3 is the maximum number of passes that I can do. So I know that if she's having a lot of stress, I may not be able to do 3. I may only get my second one and it's stressing her out so much and I'll just have to come back later, reassess her and see if I need to section her again. But I have to make that determination based on the total picture. You all are getting ready to skill test and guess what? You're going to be focusing on this and not looking at the total picture, but you got to make sure that you're watching your patient. So I'm also going to let her know that while I'm sectioning her, if she's starting to get frightened or something else is going on that I'm not aware of, I want her to lift her left arm, tap her leg, do something to get my attention. I'm going to have on sterile gloves. I do not want her to reach up and grab me. So I'm going to establish some type of communication so she can alert me that something's going on. Can you stop, please? Okay, so I've established a line of communication. My stuff is working. I've already auscultated and I hear some rhonchi in her lung field. So now I'm getting ready to get started. And I can tell you that I can put this on here. I may save a few secretions, but it's possible that she's getting ready to cough one and Chelsea or Megan may just get something in their face because they cough it across the room. So be aware. I've got on my goggles. I'm checking either my sterile water or my normal saline, whatever I have. It's not expired. This one has been opened and it has been dated and timed. It's good for 24 hours. If I'm the first one to open it up, I'm going to date and time and initial it so that the next person will know. Now they have those little individual ones so that we're not wasting a whole big bottle. So you might just see some of those little individual ones that you might get out. So that's good.
You don't count them?
No, not unless they're in isolation.
So just eyes.
Yeah.
Yeah.
It's not in there right. But that's okay because guess what? Do y'all have that problem? Grab my box by the cardboard. Pop it open. Okay, I've already checked that. If I say lip it, do you know what I'm talking about? I open it up. If I say lip it, it means I'm just pouring solution over the lip of it to, just to kind of clear that. And then I'm going to fill that up. Okay. What should be next is my sterile gloves. I've touched here.
Oh, what good critical thinking.
Like we've done this before. And I know that you would go, oh, that's not the way I need it. I'm going to have to rearrange it. said boost my.
Those don't look
You
too
can
good
do it.
either.
What's the matter with it?
He said they're butchered. I think that's
Oh.
what he said.
She's good.
That's okay because look, guess what happened? That's okay because that loose finger that y'all let keep flapping around, I'm going to try to secure so that it doesn't touch anything.
She's really doing a good job. It's almost as though she planned it this way so she could keep all that.
Yes, Miss Whitaker, sure.
I'm trying to help you.
I know. Don't we have fun and skills? Okay.
We do.
Oh, can I, Miss Jones, can you push your call light for me? Hi, this is Shelley and, blah, 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 and I just need someone in here for a second. I'm getting ready to do this sectioning on the straight. Okay, can you just pull that back but don't touch anything? Thank you. Okay. And I utilized my patients. They're not going to be able to talk. Usually if someone has a trach and they're not talking, usually a bell will ding at the nurse's station to let us know, but I was able to talk. Okay, so I'm looking at my catheter, and it's intact, and so I'm right-handed, my dominant hand. What I'm going to do is I'm going to wrap this around my dominant hand, and then I've got the end of this catheter exposed. This hand I'm getting ready to lose. This is going to be my contaminated hand because I'm reaching down and I'm touching this suction catheter. I already had seen that it was at between 100 and 120. I'm getting ready to push this in. I am not going to contaminate my right hand. Push that in. I never touched any of that. I'm going to put this on. I'm checking my sectioning again, making sure, and I can touch the tip of this because guess what? It's sterile, but so is this hand. Okay, so now I'm getting ready to, don't fix my box for me. Usually once you put your solutions in there, it will actually fill it up and open it up for you.
Okay, I'm not doing this.
No, Deaconess, their trach care tips for a solid plastic, so they utilize that tray.
Okay, so dipping that in there, it serves a couple of purposes. It is, I'm checking my section, make sure it is sectioning, it is, plus it's lubricating the tip of this. I don't want this dry going down into that airway because it's going to grab. Okay, so I'm looking at her O2 stat monitor there, and I'm looking at her pulse. Miss Jones, can you take 3 really deep breaths for me, please? Okay, when you're sectioning, you never, ever, ever, did I say never, ever, ever, have your thumb on the section when you go down. That's an automatic failure. That thumb better be up out of the way. And I tell you to hold, once I get in there and I apply this section and start sectioning, hold your breath. When you go, I gotta take a breath, guess what? So does she. And so that's gonna because if you're just kind of like taking your time, well, hold your breath while you're doing it because you're gonna see, oh my gosh, a few seconds, I'm ready to take a breath. Okay, so my thumb is off. I want to only hit the inside of that inner cannula. I don't want to be over it because guess what? I don't want her to cough in my face. Once I get down and I hit that bifurcation where it splits, she's going to go. I know I've gone as far as I can go. I'm going to pull back just a little bit and then I'm going to start sectioning. Mrs. Jones, take 3 deep breaths for me. While she's doing that, I'm doing this, and I'm looking at her monitor to see how things are going. You did a really good job. Got some secretions. I can see some secretions in here when I was sectioning it out, but they just look like some, clear secretions. I didn't see any color in anything. Okay. You ready? I'm going to do this again. I get in. So I start.
Now you see what she's doing? She's not applying continuous suction. It's intermittent. And if you do continuous, that's another failure.
Yeah. And then another thing that I'm going to show you is because how I hold it like this, I go in. I'm using, and this I'm keeping here so that because if I just pull this out and I have a long end to it that could touch her chin, her gown, or someplace like that and contaminate it. So what I do, and you just practice and you're going to see what works best for me. I keep my hand here and I use this, and this right here is what's pulling it up. You all sometimes want to do this. And where is that touching? But am I even paying attention that it's touching my arm? Because no, I'm going, oh, she's coughing. And you're not even aware that it has touched your arm because you're so focused on that little area there. But guess what? We see the whole picture. So by doing it this way, keeping it above my hand, it's not going to curl because you're going to see it has a tendency to curl because it came out of that package like that. So I did my third section pass. Take some deep breaths for me, Miss Jones. You're doing really great. Last thing I'm going to do is clear this tubing. It's not this tubing that I'm clearing. In reality, it's this tubing because if I didn't clear this tubing and those secretions started drying in there, it's going to decrease the diameter of this, which increases the pressure that it's actually pulling when it's suctioning. So this is what I'm rinsing. Okay, so I did the last pass, rinse this out. Toss that, get my stethoscope. I'm going to listen to those breath sounds again. Sounds a little clearer. I know that as I was doing this and it was stimulating her to cough, it was moving those secretions up so that I was able to suction them out here. So she sounds clearer. I see that her stats are in the mid-90s. Her heart rate's back down in the 80s. It's at baseline. So she was able to tolerate this without having, if I said tolerate well, and y'all have a tendency to say she tolerated it well. But what I think is well and what Laura thinks is well and what Abby thinks is well is three different things. So tell me, how do you know she tolerated it well? Well, her heart rate didn't deviate from baseline. She didn't become tachycardic or bradycardic. She didn't stop me, blah, blah, blah. You know, that's more objective versus she tolerated it well. It's kind of subjective what our interpretation is. So just get in your mind what you think. Are they documenting? Or were they telling us?
They was going to tell us what we've been doing.
So just tell us, So document that I heard bronchi and upper lung fields sectioned using sterile technique times 3 because I did do 3 passes. Removed. Looked at the little canister there and I maybe got 15 milliliters of clear secretion. Something like that. Patient tolerated procedure by not deviating from baseline of heart rate. Blah, 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 blah. Sign it. Okay? So this is sectioning on room air. Now I'm going to have a patient who's going to be on a vent.
When you're putting the suction down there, could you accidentally